I'm your host, Rick Janata. Our topic, finance, technology, not-for-profit management. Look, you can't talk about that and not talk about generating a margin, certainly in healthcare. And to that end, we have a great guest, Thad Calabrese. And Thad is the Associate Professor of Public and Nonprofit Financial Management and Director of Finance Specialization at NYU's Wagner School. And his research and teaching focus is broadly on financial management theories and techniques for organizations in public sector, public services, and in healthcare. And he's a very active researcher, has published many texts as well as public policy research reports. He serves on the board for the Journal of Public Administration Research and Theory and Public Budgeting and Finance as well. And he's the associate editor for Nonprofit and Voluntary Sector Quarterly. And prior to joining NYU, he was with the New York City Office of Management and Budget, where he really specialized in tax policy. Glad to have Professor Calabrese on the show. Welcome to the Healthcare Nation podcast. I'm your host, Rick Janata, and we're committed to bringing you thought leaders in the field to discuss what's new and noteworthy in the health sector. This is the Healthcare Nation podcast. So glad to have you on the show. I feel like we've got a lot to talk about. Yeah, and first, full disclosure, Thad and I are both working together at NYU. I'm associated with and have been at the Wagner School for many years. And Thad, you've been a professor there for a while, and now we're both in the Health Law and Strategy program. That's a new degree. So hoping we could perhaps connect some dots on what we're talking about today to even those programs. But
Absolutely.
But with all that said, what have you been up to lately, my friend? What's happening in your world?
I am the coach of my youngest son's baseball team, and that started at the beginning of April, and it is a blast. We have a lot of fun, and it is something I look forward to every year.
Well, let me tell you, as an ardent supporter of baseball, and perhaps someone who, full disclosure, is not too happy with some of the changes they're making with respect to the bases
Agreed.
and all that, I've had the great honor of leading, some pretty high-performing healthcare institutions and enterprises across the country. And one thing I always said was, when it came to financial management and fiscal responsibility and being able to, dare I say, generate a margin, whether you're a for-profit or not-for-profit, and most of the institutions obviously I was associated with in the hospital and health system space were not-for-profits, but you had to drive that margin. And if you didn't, you would lose the opportunity to control your own destiny because someone else would come in and do that for you, whether it's the board or some other structure or just the market forces or losing your competitive advantage. And with that as a backdrop and knowing your area of expertise, what do you see as the biggest challenges that are really facing, healthcare leadership and these organizations in terms of financial management today in 2023?
When you see issues, problems, whatever bubble up, you can either address them and deal with them yourself, or you can have them dealt with by some other party. And obviously, when the other party deals with your problems, you may be less than satisfied with how they deal with your problem.
So true. So true.
So I do teach financial management for healthcare organizations, but also for government and not-for-profit organizations. Before I went into academia, before I got a PhD, I actually worked as a consultant, and I worked with healthcare organizations who tended to be smaller, not-for-profit in general, community-based organizations. What interested me in my early and current research was addressing some of the issues I saw as a consultant working with organizations that were struggling in many ways with their financial management. So this has been something that I've been thinking about for decades. I think it's fair to say that, unsurprisingly, they are feeling financially very squeezed right now. There was there was a concern in 2020 that with the pandemic that there was going to be lots of financial problems that hospitals were going to face as they dealt with the pandemic, but that there were, lots of public programs and resources made available in an attempt to avoid or stave off some of that problem. But, you know, it doesn't mean that that has solved any of the problems. So if anything, a lot of, and this is true not just for hospitals and healthcare organizations, you're seeing it in governments as well, that a lot of governments that were having financial problems got a reprieve from all of the money that came in, whether it's New York City or the state of New Jersey, they got a lot of money from the federal government. And rather than having to make very difficult budget decisions, they were able to sort of buy themselves some breathing time. And in a lot of ways, I
Yeah,
feel like
kick the
that's a
can
lot
down the road. Yeah.
kick the can down the road. In an ideal world, what that reprieve should do is allow managers, or in the case of government, elected officials, to sort of make better decisions because you don't have, the grim reaper of financial doom
Hmm.
breathing down your neck. But as we know, that's rarely what actually happens. It does turn out to be, rather than sort of a resetting or repositioning, as I describe it, it does tend to be, as you describe it, kicking the can down the road, especially in public organizations. But, in terms of just hospitals, profitability, we obviously don't have 2023 numbers, but, in 2022, profitability for organizations, for hospitals, just absolutely plummeted compared to where it was in 2019 before the pandemic.
When you're looking at the not-for-profit side and perhaps running a deficit in the context of that designation for an organization or a system, or in this case, let's just say a hospital or a health system, would not be tolerated clearly on the for-profit if you had shareholders and there's an expectation with respect to a return on investment. That's one piece. But it really brings me back to the point that regardless of either position, if you do not generate a margin, you're not going to control your own destiny. You won't have the purchasing power. You won't be able to be competitive in the market, and ultimately it could be a very negative situation. Now, what I do think I'm hearing in this is the challenges that we just discussed, absolutely, but they're being compounded now by things like shortages of key personnel.
Mhm.
And it's not so much that you want to shed labor. You can't even find the folks that you need to
Right.
perhaps deliver care, which is an added stress. Would you
Right.
add to that?
We had situations during the pandemic where, some employers, I guess a lot of healthcare employers, were requiring vaccinations and letting people go who didn't. That certainly didn't help workforce issues. Every single person I talk to who works in healthcare talks about burnout. People are just tired at this point. And I'm not just talking about, frontline workers,
Yeah.
those doctors, nurses, technicians. I mean, even talking to admin folks in some healthcare organizations, people are just exhausted from the past few years, which is obviously then going to have an impact on, the quality of their work, the professionalism of their work, things like that. We've had healthcare organizations, the rest of us are facing supply issues. The costs of energy are up. These are energy intensive organizations. The price of commodities in some cases have increased. Um, we've we've seen some of this banking crisis develop, last month with SVB and some other banks that have had some issues. There's been a tightening of credit. And so organizations that require, access to the capital markets are going to find that the capital markets are less accessible going forward than they have been for years. If you open up a textbook, nonprofits have equity, that's not called equity in the nonprofit sector. You can't go and sell ownership shares in the organization. you can certainly go and raise money from foundations and individuals and other philanthropists, but you can't issue equity shares. And so the reality is that nonprofit hospitals borrow a lot of money. And if you look at their balance sheets, they have significant debt. And so much so that I, now that I think about it, when I teach financial statement analysis in to my students in intro courses, when we sort of go over benchmarks, I always tell them, if you analyze a hospital or other healthcare organizations, you will often find that they exceed sort of generic rules of thumb for leverage ratios.
Mhm.
I said, and that's not really a problem. And then I explain, these are capital intensive organizations, especially if they're nonprofit, they don't have access to the equity markets, and students generally understand that. But if the organizations now face a credit market that is significantly more difficult to borrow in, that is a source of capital that will be increasingly difficult for nonprofit healthcare providers to access. And those that are able to access it will certainly be accessing it at higher interest rates now, which is going to also exacerbate the growth in expenses, which I didn't mention, but one of the other issues has been, the explosion in spending by healthcare organizations.
Yeah. And the necessary investment. When I think about just keeping up with, aside replacing, say, ORs or imaging equipment, but just in technology in general.
And that's that well that and I would argue that's actually a separate issue altogether. So just on not on capital investment, which you're absolutely right, is absolutely necessary to keep up. That's growing. It's growing more expensive, and the cost of borrowing as it increases only makes that cost go up even more. But the operating expenses just needed to do whatever the mission of the organization does, those expenses in the last year or two have exploded.
Right.
Expenses.
And you could see the days cash on hand just shrinking across the board when you look at things. It makes me think that although we could say there were historical maneuvers that CFOs, CEOs would take in times of very tight, tight margins or impending issues with respect to cash flow, et cetera. I think we're in a different day now for all the reasons we just discussed. Do you think that this is pushing institutions more towards consolidation when we take a look at that and the M&A activity across the board with hospitals and health systems?
Absolutely. What we are going to see as a result of this is an increase in that activity. We've seen a consolidation already of healthcare providers. Thousands of organizations over the past few years have merged together. And I think as a result of some of what we have been talking about, I think that is likely to continue. There are obvious public policy implications to increased hospital mergers. They do seem to help with keeping some costs down. You do seem to get some economies of scale.
Right.
Maybe not universally, but on average, you seem to get some economies of scale, whether it's billing or, other admin capabilities. But it doesn't seem to drive down, the cost to the consumers or to the payers, insurance companies.
Yeah, that
Now,
I was gonna add that. I don't know that it's translated through to the end user, whether it's employer sponsored or perhaps more importantly, the consumer slash patient.
on the one hand, you can get some cost savings from this merger and acquisition activity, but on the flip side, as you reduce competition, basic
Yeah,
economic theory dictates that prices aren't going to go down. It's you consolidate. In this case, there's a whole host of reasons that mergers grew in number and importance over the past decade, whether it was, you know, you know, Obamacare, the ACA incentivizing the move to outpatient care. So,
Mhm.
hospitals were like, "Oh, we better, buy a bunch of outpatient center, like ambulatory
Build
centers."
out your ambulatory platform. Yeah,
It's like,
right.
or build it out. I know a lot of the merger activity, earlier was those acquisitions of those outpatient centers. You had Macra, moving towards quality of care versus quantity of care. And larger providers do a better job with managing all of that reporting. You were talking earlier about the regulatory requirements. It's hard to measure and report on quality. And not surprisingly, larger organizations do a better job of it. So the smaller organizations, really couldn't cut it.
Well, yeah, I would say in some cases, they may not even be able to afford to have the kind of infrastructure that's required
Right.
to have a, I don't want to say credible, but
Meaningful.
a meaningful, publicly reporting system so that they could benefit from that in a particular market. I mean, I think that it comes down to cost. But and you're going to see whittling or changing the state Medicaid side of things, and wherever levers can be pulled. There's no doubt about it. But let me tell you, in my experience, I had always looked fairly holistically and say a balanced scorecard approach,
Right.
looking at clinical performance, patient experience, certainly satisfaction in there, but also financial performance because of all the reasons we talked about. I had them on the same balanced scorecard. That was just a practice that I did historically. But I want to talk specifically in the areas of, let's just say, financial management, financial practices, the pressures that are happening today, but the imperative to make sure that quality improvement and patient safety, clinical outcomes are still like the end game here. How do you reconcile those two, particularly when you have the kind of financial pressures that we're seeing organizations have right now?
Healthcare organizations struggle with the tension between that. They struggle because that type of reporting, that type of measurement even requires resources. And many times people, institutions, funders, whoever view that type of spending as non-core to the mission of the organization spending. I think in healthcare, unlike in other nonprofit organizations, I think that is less the case because there is a recognition that this is important and this is what we really want to get at. But it's still not something that all funders of all types are unequivocally on board with wanting their money to go to.
Yeah.
I mean, if you asked, a philanthropist might understand why it's important, but he or she would want their money to go to some new program, that does whatever it is they're into. It really is a tension, especially in a time where expenses are up significantly. Um, the other issue that I forgot to mention earlier on the challenges is for those organizations that are lucky enough to have investment portfolios, they just took a bath on their investment portfolios. And those investment portfolios often provide a lot of the capital needed to shore up those areas like quality measurement and performance because it is harder to fund those areas. As that source of capital dries up, areas like what we're talking about with outcome measurement and management and performance, you have to spend money in order to collect data, to analyze data, to report on data. And this is fundamentally another data source, database.
And
To help.
increasingly more important to the health system, and the way we deliver care.
These are imperfect measures
Right,
that are
right.
in
Yes, true.
that
So true.
that we do. But it is a movement towards being able to measure very difficult things. We don't care about how many times did hospitals readmit the same patient. I mean, that's interesting from a payer's perspective because they want to make sure that it's not, you're just not readmitting people all the time. But fundamentally, what we care about as a consumer is, did they treat the patient? Did they get the care? And did they become healthy as a patient? And again, while the quality measures aren't perfect by any stretch of the imagination, they are at least a movement towards those measures of performance that we do care about. For a lot of the nonprofit sector, that that is something that the sector hasn't even taken the first step in. In higher education, we don't really care about graduation rates and how many years that it takes students to graduate from college. We really care, did the university provide the student with a quality education as expected? And how do you measure that? We haven't really measured it. You could apply the same logic to, human service organizations, anti-poverty organizations. We for so long, the nonprofit sector in general has been, viewed as this, trustworthy sector that gets lots of money from donors and from the government and you know how do you know that they're doing what they're supposed to be doing? And increasingly people are saying, how do we know?
There's the expectation, as I said earlier, on
Exactly.
a return on investment. And I think
Exactly.
you're
And
going to see more of that. But let me stay on the perhaps the topic of investment, if I could characterize it that way, because I really think it's important when we look at what's going to be needed, certainly for hospitals and health systems in the future. They're going to have to invest in new technologies and infrastructures. I mean, that's been our guests all this week talking about that and balancing what I would say are absolutely necessary investments. And then, next generation, this is where I need to be. And we're seeing such an explosion in the benefits and applications of artificial intelligence in clinical care, et cetera. How do you balance the need to control costs and maintain financial stability with those necessary investments? How would you teach that?
that's the $1 million question. How would I teach that? Let me think about that out loud as we talk about it.
Yeah.
Well, it's an interesting conundrum in healthcare. Healthcare is rife with examples of technological investment that was supposed to reduce cost, cost a lot of money because it's a capital investment, reduce costs and make delivery better. And it may have made delivery better, but it certainly didn't reduce cost. There, I'm not sure the jury is totally in on, electronic health records, for example, but, there's certainly that was an expensive investment for many organizations. And, I'm not sure if there has been a reduction in costs. Maybe there's been an increase in revenues though, which would be, which would,
Yeah.
would certainly be worth it.
Precise documentation. I mean, there's no doubt about it. There could be a correlation.
Precise documentation, easier to upcode. I didn't say that though. Anyway, but the point is that for a lot of these investments to to pass the investment analysis that we would teach students, the model we would teach them is, you would want to look at, what are the benefits that accrue from that investment, what are the costs that accrue from that investment, not what's already happening, but the marginal benefits and the marginal costs and, you know, discount them back. And, if there are more benefits than costs, it will be positive and you should do it. And, and the interesting thing in healthcare is that that model works in many ways. And in other ways, it fails or is not the best descriptor of the healthcare environment because some of these investments, as you said, are just necessary to do what you need to do to stay on, the cutting edge of treatments, to attract talent to your organization, um, to have quality measures that, so that you can people recover better and they're happy. So there's a whole host of reasons why, that traditional model is difficult to use in healthcare settings. A an ivory tower researcher or teacher might argue back that all of those are benefits that should be captured in that model. The benefit of, improved quality, the benefit from attracting higher talent, talented doctors, nurses, technicians, etc. Those are
And I would even say being a destination for patients, right? I mean, that would
being a
go into it as
destination.
well. Yeah.
And theoretically, I would be on board with that and would totally agree. The problem is trying to place those benefits or those or costs. If it's AI, you're replacing workers, so that's a benefit to the employer. Do you count the benefit, the cost to the employee? Probably not, but sort of from a larger perspective, maybe you want to consider it. Yeah. Monetizing all of those benefits and costs are extraordinarily difficult.
Yeah. There's no
Um,
doubt. And I think getting increasingly complex when you think about what we
yes.
have to deal with.
Issue is that you have these investments, which I agree in many cases are necessary and they're expensive. So they're going to drive up your operating costs. It's going to, if you borrow, it's going to drive up your interest costs. They're capital, so you're going to depreciate them. They're going to drive up your depreciation costs. Um, so these have real implications to your financial performance as an organization. If nothing else, these will impact your profit and loss statement. In some cases, as we said, you can generate more revenue. You might be able to see more patients. That's great. But in some cases, you're just keeping up with it's the same number of patients. It's just a new technology, and you're not even necessarily being completely reimbursed for it through third party payers. So, I mean, this really does speak to, um, in the case of nonprofit organizations, for example, the need to generate profits on a routine basis, because that can become your source of capital. That source of capital is not free. There's an opportunity cost to that capital, but that capital could be used for that type of investment so that you don't have to borrow as much, to invest in this. If you are a for profit, it certainly does speak to the need to, again, be profitable and to be able to attract ongoing capital. And the only way to really do that, I think, is as you started this episode with, is by being resilient, by being profitable, and being able to do that over time. We have to just be a little uncomfortable with the fact that we don't have all the data to feed into those models, and that we can't just count on artificial intelligence. We can't count on whatever the latest chat GPT to tell us if it's a positive net present value or not. There is still the need for that judgment, for that assessing of those softer costs and benefits that we're just not really that good at yet estimating.
Yeah, I hear you. So listen, as we wrap up our time together. Last
Yes.
question. And I like to end on a more optimistic note, although this is a tough topic to do that. What what's the fundamentals? What's the advice you give to healthcare leadership today in 2023 that will give them the kind of insights and perhaps a deeper understanding of the maneuvers and instruments they may have to leverage in the future if they're going to be successful in sustaining, maintaining, and hopefully flourishing in the future?
Healthcare is such an interesting field because such a large chunk of the revenue are beyond the control of the organization, to set prices, for example, or to expand services in some cases. I've heard very funny stories from New York hospital executives about certificate of need regulations and some of the things they've had to do to expand or maintain services because of those. What do I tell executives? Executives don't listen to me, but what I do tell students who hopefully will one day become those executives is, um, it's a very strange industry that they've opted into. They won't control large parts of their revenues. But what they do need to understand as a manager is that they need to understand their costs intimately. They need to understand that even if they're going to be at a nonprofit, that they have to earn profits and not be apologetic about it. I've had hospital executives speak to my classes, and this was before the pandemic, and they were almost apologetic about the profits they made. And I would interrupt them and say, like, you just basically said, you have a 3% profit margin. My students are not going to be offended by a 3% profit margin after listening to me for the whole semester. So don't worry about it. If anything, they're going to argue that you need to get that profit margin higher and beyond profit.
Mhm.
Um, they need to be able to make the case for why these profits are necessary, understand costs, because that's what they can control to some extent, and have to make the case for why things like quality is an important task for healthcare organizations to be focused on, but it's also a task that requires resources, and and that case needs to be made vocally. You can say, well, that this guy's just basically saying go to the government and ask for more money, and then you go look at everything I write, and it's, our budgets are exploding and we need to shrink them. The point is, the public side, the public needs to get a better grip on where the money is going and what it's spending money on, and it needs to be more focused. And it needs to be focused on things like, how do we measure and report on quality? Like, that is something that should be a focal point for state governments, for the federal government, because of the amount of money we're spending on this really important issue. But other than that, I don't have any magical prescription for how to make healthcare more profitable than it is. I'm public-private partnerships, which we didn't really get a chance to talk about. That's an interesting model to explore. Opening up, if there's still certificate of need limitations in some states, opening, do we still need that? Is that limiting competition and keeping prices higher?
Yeah, we know that there's a lot of that activity being tied to certain bills that are in state
Yeah.
houses, et cetera, that are
Yeah.
there.
Is the nonprofit form the best form for, healthcare provision? It might have made sense 50 years ago. Does it make sense in 2023? Should we be thinking more of for-profit providers? I don't really have an answer to any of those questions. Those are the things that I think, the people who are much smarter than I should be thinking about, and in pushing the discussion on.
That there's a lot to think through on that, and many questions that have opened up. And I want to thank you, Thad, for being on. I mean, this was informative and opened up, I think, a line of, as I said, inquiry and discussion that we're going to have you back to unpack a few things, including the for-profit sector and what I often characterize as private-public partnerships
Mhm.
versus public-private. So let's do that, my friend. And in the
Sounds
meantime, it's been great having you on the Healthcare Nation
Thank you for
podcast.
inviting me.
Super. Thanks so much.
Thank you.
The opinions expressed by the host and guests are for informational purposes only and not associated with any companies or academic institutions. Please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And if you have any questions or want to contact us, please reach out to healthcarenationpodcast.com.